Happy Monday, everyone. Hope you guys had a great weekend. Really excited to have a special guest today, who is the founder of a huge pelvic health support network. So I am just waiting for her to come on, and she should be on shortly, and then I'll have her on. Hi, Auntie. And I think you guys will really have a great, just get a lot from her. Her name is Marnie, and she is going to tell us all about why she started this network and what she hopes to accomplish with that, and what she wants the general public to gain from it. So I am just waiting for her. So let's just give her a minute.
Hey.
And
How's it going?
hi. Good.
I
How
have
are
a very
you?
low voice because I woke up with a cold. So, yeah, so I sound a little
Oh
bit
no.
low, but I'm okay. Yeah.
Oh, thank you for
Oh, it was
joining.
great.
How was spring
Yeah,
break?
it was really nice to get away. So warm and sunny. Yeah. I yeah, I'd love to be on the
Beautiful.
West Coast. It's so nice, the weather. Yeah.
Oh man. Yes, there's so much sunshine, but it is a little
Right.
chilly still. So, um, yeah. But thanks for joining in today. Hi, everyone. For everyone who is watching, please tell us where you're watching from or listening from. And if you're watching this at a later time, just hit hashtag replay. And I'm really excited to have Marnie here. She's going to tell us a little bit about herself, and then why she started this amazing network. And we're going to talk a little bit more about that. So welcome, Marnie. If you want to just introduce yourself to the audience, that would be great.
I'm Marnie Glavin. I've been running pelvic health support for the last couple of years. We're a patient-centric resource for those struggling with pelvic health conditions, and our goal is to help people navigate the system, whether they need to find care, they need to understand, a more biopsychosocial approach to their pelvic wellness. So basically for me, I started this as a result of my own struggle. So I started having interstitial cystitis symptoms at a young age of 22, and I didn't really know where to turn to. And I wish that I had a resource like this because it's super helpful. You can be proactive. We have videos that allow you to get involved in trying different things like mindfulness meditation, mindful movement, things like Qigong, restorative yoga, pelvic physio. Physio yoga, allowing you also to find people like pelvic health, I should say, because we call them pelvic physiotherapists in Canada, and in the States they call them pelvic physical therapists, pelvic health physical therapists. So we're talking to everyone in North America, so either one. We do have a large network of pelvic health physical therapists, physiotherapists on our site. We also help you out with diet. A lot of people with pelvic health issues feel, they're told to try gluten-free or dairy-free. They're looking for bladder-friendly. We have a diet. We have videos for each condition, webinars, supplements that are beneficial for each condition. So everything's kind of broken out by condition, which is helpful because pelvic health is such a vast array of conditions, as you know. So we do break it down, and we're not just focused on women's health. We focus on men's health as well. So we have chronic prostatitis, erectile dysfunction as well.
Okay, I'm going to stop you right there. Because that's a lot of info. So you had mentioned that you you yourself had at a young age a diagnosis of interstitial cystitis. And what did you do then? Like, who did you talk to? What kinds of things were you looking for yourself? Because I think that's something that's really important to talk about, because many women are diagnosed with some sort of pelvic condition, but we then don't always get the resources to be like, okay, so now these are the things you do, or it's strictly medical or strictly lifestyle, and we don't always put it together. So as a 22-year-old, what did
So
you do
at that point, I thought the urologist was my only, the only person that could really help me. And I had a good urologist, but it started out, I was in university at the time. So I was about 2 hours away from home. And the experience was actually quite traumatic because I had been dropped off for a cystoscopy that was not under general anesthetic. And it was so painful that they couldn't finish the procedure. So I had to have it again when I graduated and returned home. And then I had a urologist at the time who was sort of getting close to retirement. And I was lucky enough to have a friend who got me in to see Dr. Leslie Carr at Sunnybrook Hospital in Toronto, who was, at that time, she was sort of the IC guru. So I really thought that was, the only thing I could do is see a urologist and they can put me on, medication. I tried a million different things at the beginning. She did recommend pelvic physio, which I did try, I would say maybe 10 to 12 years ago for the first time. And I really had, I had no idea what to expect. There was really no information out there. They were few and far between as well at that time. Now it's, become quite a large, quite a large group of people do pelvic health.
Well, let's back up there too. What would you say is pelvic health or pelvic physiotherapy, or pelvic physical therapy, whatever? Whenever I suggest it to patients, they're like, "What? Never heard of that," So for someone who's watching who's never heard of a pelvic physical therapist, like, how would you describe them in your own words?
So
like, what would you
basically
say?
they're trying to help. So I would say we define the pelvic floor as hypertonic or hypotonic. And so whether you have an overactive pelvic floor or an underactive pelvic floor, it's a very different protocol that a physiotherapist will take. So a lot of the times, conventional medicine, a general practitioner will tell someone who has pelvic health issues to do Kegels. When you have a hypertonic pelvic floor, that can be quite detrimental to your pelvic health to do that. So that's something that's really important for us to sort of, understand that we need to sort of get past that and understand that there are two different ways that the muscles can be. And I think that, that's so important for people to know. And so many people, and I see in the support groups, just people not understanding how that works. And just being guided into thinking that Kegels are the only answer for any pelvic health condition.
And they may be, and they may be for things like if your uterus is fallen down, or prolapse, right? But the pelvic floor is so complex. I mean, there can be prolapse. You could have tightness. You could have pelvic pain. You could have pain with sex. You could have with the bladder filling, with interstitial cystitis. So it's a very, very complex interplay of muscles and organs and ligaments. And so, as you said, it's really important to figure out, like, well, is it too tight? Is it too loose? And then what do we do about it? And so pelvic physiotherapists or physical therapists are essentially physical therapists who study the pelvic floor. And it's really, when I was in medical school, I don't really remember even learning about that term. And, in residency, it started to. So it's a fairly new sort of field, but it is out there. It's becoming more popular. More people are, finding out about it. Insurance companies, many do cover pelvic floor therapy. So this is something that, you definitely want to seek out and, ask your physician to hook you up with, and put in a referral if it's something
and the great thing is now a lot of pelvic health physical therapists are taking a biopsychosocial approach. So we're realizing, the central sensitization piece and understanding that the brain has a major component with pelvic health. So this is really, really, really key. People need to sort of understand this connection, which I think a lot of people are like, well, if I have pain in my pelvic floor, how does that affiliate with my brain? So they need to sort of understand the connection of how pain stems from the brain. And I think a lot of people, like physiotherapists now, I keep switching to what I'm calling them because I'm in Canada, I'm used to calling them pelvic.
That's okay. You got
it. But I'm trying to talk to everyone in North America here. So sorry, I keep switching terms. But yeah, people do really, and it's hard for a lot of people to understand that. But the thing is, it's beautiful that a lot of therapists are taking that approach now and addressing the mental piece. And that's why on our site, mental health is extremely important, and understanding that you have to, with pelvic health, reducing your stress is huge. So that mindful component is massive and really needs to be addressed. So that is something. The diet piece as well.
Too.
But I would say first and foremost, that stress reduction is almost always number one for not every condition. Like we're not talking, maybe prolapse or fibroids, but when we're talking chronic pelvic pain, conditions like IC and endometriosis, and CPPS, prostatitis, that is a really, really important component.
Yeah. I'm glad you said that, because I think we underplay the role of stress. We think about stress and high blood pressure. We think of, that's probably one of the most common things I see in the office. Oh, I'm so stressed, and that's why my blood pressure is high. But we don't think about necessarily stress and other things, especially, when it comes to women's health. We think about stress and heart attack, right? But this, the pelvic floor, as you mentioned, all of these conditions can also be significantly negatively impacted by stress. And sometimes it almost seems like a kind of like woo-woo, like, oh yeah, stress, but as you said, like that is probably the primary thing to really focus on, which I love. And it's all of those things, like doing fewer things in your life rather than running around like crazy, right? Like trying to overextend ourselves, like, today's society.
Hard to keep everything
together,
and it's just, we're so inundated. Constant information being thrown at us and having to do a million different things, and managing the mother and the worker, and making dinner and getting everything done by the end of the day, making lunch for your kids for the next day. It's like a constant. And I find for myself, I know exactly when I'm flaring, it's always caused by stress, always. So that's why I do yoga. I try to do it. I need to do it more than once a week, but I go once a week. I dedicate an hour a week to go, and I find that really helpful for me. But it could be something different for somebody else. So like I said on the site, it's finding what works best for you and finding what you can do to keep your symptoms at bay as best possible. Yeah.
And then, so there's a lot of resources there for that. And then, can you tell us a little bit about diet? I know there's bladder irritants that can definitely worsen IC, but for those listening, can you just throw out a few things that, people should try to avoid?
The bladder is very sensitive to acidity. So when we, things like orange juice, coffee, carbonated beverages, chocolate, those are all, foods with caffeine, those are all irritants. They can definitely bother the bladder. There's people who look at different diets. There's, the people who look at low histamine, low FODMAP, depending on what you work best with. But the problem with diet is that people start to restrict and restrict and restrict until they're eating very few foods. So the elimination diet, if you're going to do it, it's important to remember that you need to reintroduce foods back in, so you can eat more than 5 things, right? So that's something that, and a lot of dietitians like Kelly Krasier will work with you to determine, what foods you can bring back into your diet, because I think a lot of people get scared And it can also lead to things like, an orthorexia type thing as well, like eating disorders, when people are constantly restricting food. And then you're also not necessarily getting all the nutrients you need. So your health is suffering in other ways. So
Yeah.
diet is something
Yeah.
that I would say, definitely address it with somebody so that they can kind of watch you and help you. Um, the way my site
Mm-hmm.
works is it allows people to take their own approach to, that we have charts, for people who have endometriosis, what foods to avoid, what foods that you can have safely, kind of thing. But again, these are just guidelines, and they're just for the majority of
Yeah.
people. You might be able to have a glass of wine once a week. Some people are okay with white wine, and if you don't try it, then how are you going to know that you can't have it? So it really comes
Yeah.
down to trial and testing, and like an elimination diet can help you do that
Yeah.
in a safe way. Yeah.
Yeah.
Mm-hmm. Mm-hmm.
Definitely. Then what about pelvic floor and pregnancy?
Mm-hmm.
Do you have resources there on as well? Because I know that's something we really don't talk about enough. And then people have babies, and then there's like,
Yeah.
oh, well, I'm feeling this and that, and it's just able to go through some of this like ahead of time and know, okay,
Yeah,
what do I
we
need to do
have
after
a
delivery?
guest blog. So every week, twice a week, I post blogs from expert practitioners, and we just had one in the last couple of weeks on push prep and preparing. And nowadays people, unlike before, where no one even knew what pelvic physiotherapy was, people are now going prior to and postpartum. Actually, in places like France, they even offer it. It's the government covers people coming to your house, and doing pelvic physio with you after you have a baby. So yeah, there's plenty of resources. There's also products. There we have a shop as well. There's lots on prolapse. There's lots on incontinence. We cover it all in terms of prenatal and postpartum as well. Yeah, it's amazing what people don't know going in, right? Like, and it's really a shame that we don't
Yeah.
have some form of
Yeah.
education in school, um, letting us know about these things. Like, even when you get to like
Mm-hmm.
perimenopause, like people have no idea. A lot of people don't want to
Mm-hmm.
know, but people have no idea what to expect when their
Mm-hmm.
estrogen levels drop, and they're dealing with all these things
Mm-hmm.
like vaginal
Mm-hmm.
atrophy and mood swings and hot flashes and
Mm-hmm.
et cetera, et cetera. It's
Mm-hmm.
like it's crazy how much we don't know, and it's unfortunate. So
Yep.
my site is really all about, it's a resource, and it's meant to educate
Yeah.
and make sure people are aware of what's to come after they have a baby, what's to come
Yeah.
after they
Yeah.
um, hit the perimenopause stage. And the practitioners on the site are
Mm-hmm.
incredible. And they're really, the people who blog are passionate. We had a woman named Mashiko. She lives in BC. She's a pelvic physio, and she wrote all about transgender gender affirmation surgery, and how people don't know this going in, but a lot of people struggle with major incontinence after they have surgery. And so she wrote a piece, and it was an
Yep.
excellent piece,
Mm-hmm.
and it's up on the site in the blog section,
Mm-hmm.
to let people know. And what I do is, I'll post them in all the relevant. So I'll post the blogs that are relevant, in all the relevant support groups, so that people can be educated. Because there's a lot of
Yeah.
misinformation out there.
That's great.
Um,
Yeah. Yeah. Or even
mhm,
like post surgery, right? Like just a lot of
mhm.
extra resources that you can get after these major life
Yeah,
events, having a baby, surgery, all of this, or just things that happen to us as we
yeah,
age, after having kids, because of our job, because we have a chronic cough, whatever it is. There's a lot
mhm,
that can be looked at. Now, I would love for you to just say a couple of
mhm,
words on
mhm.
men as well. I mean, I'm a gynecologist, so my patient population is women, but I think we don't really, I haven't heard anything in the medical literature at all really about men and
Yeah.
pelvic floor. So what kind of things are men coming looking for, and that your
So
website,
a
helps
big
with?
problem, I think, with IC specifically is that the stats show that over 90% of people who have IC are women. It's not the case. There are so many men who are diagnosed with chronic prostatitis, chronic pelvic pain syndrome, who actually have interstitial cystitis. So there's a major disconnect there, which is unfortunate. And I mean, I'm glad to see, because I look at the stats on my site and I see the male-female ratio, and I see the male ratio climbing, which is great. Like, we're almost at 30% now male. Yeah. And,
That's great.
and
Yeah.
I'm always like, when I speak to someone who focuses on male pelvic health, it excites me because, they really need education. They're kind of scared. They're not as open as women to talk about these kinds of things. So, they're a little bit more hesitant to be open, and support groups, like, you'll even see the majority of people in these support groups, they're dominated by women. But there are some that are specifically for men, and it's just, they have a lot of issues too. They have a lot of issues with pelvic health, incontinence. They have chronic CPPS. They have IC. They have erectile dysfunction often after having a prostatectomy. So there's that whole piece. Prostate cancer survivors, major issues there. Susie Gronsky, actually, she's a pelvic PT and sexuality educator who also wrote a piece on my site, and she's excellent, and she focuses 100% on males and male pelvic health. She also has a book out as well that's on my site. So she's great. But yeah, I mean, when you see, and you also see, like, you rarely see pelvic PTs who are male. So then, is there a comfort for men to go see women pelvic PTs? Sometimes yes, sometimes no. So it's a much harder thing for them to sort of, approach and deal with. So they tend to focus a lot more on, like, the products, I would say, more so than anything. Like things like clamps or inserts or things like that they're just looking always more so for the quick fix. So here's hoping.
Rather than taking care of the underlying problem, and which is much harder and takes a lot more time.
So it's
but that's a great point.
Like, that was the whole thing. I was like, I didn't want to exclude anyone. I mean, everyone has a pelvic floor, so it wasn't about excluding anyone who it's never sometimes know how to address the terms, even when I say, you go but and then also, like, the trans population as well, we address them as well. So it's pelvic health for everyone.
That's great. That's awesome. I'm so glad that you started this, and you were coming at it from a patient perspective, because you, as you mentioned, had a diagnosis of IC, and then you were like, okay, there's not a lot out there. How do I approach this with a biopsychosocial, take on it, and then creating these resources. So I think I looked through your website. It's fabulous, and I encourage everyone to really use those amazing resources that Marnie has put together, great blog pieces, and the exercises. I mean, there is so much in there, and it's all free, right? It's free. So tag a friend who could, listen to this, send it out to people, pregnant friends, really anybody, endometriosis. Really, actually, anyone should be reading this stuff, because, as you said, we all have a pelvic floor. So at some point or the other, we're going to have some issue with it. So starting to really take care of it now and see what we can do. And as you mentioned, reduce stress is amazing. So I think it's one of the probably the most comprehensive kind of source that I've seen for pelvic floor health. So I love it, and that's why I had you come on. And thank you so much for creating that. We have somebody said, I have IC and always need any advice I can get. Thank you. Yes, absolutely. I think you should check it out. And I think more and more people are comfortable talking about these diagnoses now. And I mean, a lot more is being known medically, but also as women and men, I think people are more comfortable just mentioning it
Yeah, the
and
stigma
seeking
is
support. So,
slowly lowering,
yeah,
like for sure. But I mean, it's still there, and it's still, like people are like, oh, private parts, and you know they don't even, some
yeah,
people take a look at a vagina and they won't even be able to label it correctly. So, right? So it's just,
yeah,
oh God. Let's just hope the education
yes,
system
yes, yes,
one day just someone just says, let's start
yes,
educating people about pelvic health because it really should be in schools. I
yes,
mean, we have sex ed,
yeah,
so how hard is
it,
it to throw it in? I don't know. It just there's a lot of people out there who are
yeah,
trying,
yeah.
haven't been successful yet, but that will be my next project for sure.
Yeah, and I think a lot of people just think it's like normal, just like leaking urine and all of these things. Oh, it's just part of
Yeah.
aging. Oh, it's because I had kids. And while some of that maybe more that make you more susceptible, we don't necessarily have to accept that it's,
Mhm.
quote unquote normal. Like there are things we can do, there are things we can do to improve our quality of life. And so I think that's the message I'm
Yeah,
always trying to
absolutely.
get to
Well, that's the thing.
people.
Like, I mean, when you
There are
have,
things
the
you can do to.
oh, I go exercise and I pee a little when I jump. It's like I thought that was normal. I had kids, and no, you can fix that with pelvic
Yeah,
PT. So,
right,
yeah, yeah. I
right,
tell my
right.
friends even, they're like, I had no idea.
Absolutely.
I just assumed that was
Yeah.
normal. Like, you know, yeah,
Yeah, yeah. Or I just put a
yeah.
panty liner and I just go about my day because that's just, in case something happens. It's like,
Hmm.
well, you don't have to do that for the rest of your life. Like, let's see
Hmm.
how we can improve things.
Yeah,
So, well, thank you
absolutely.
so much for coming on and sharing, your knowledge and just the resource you've created, which is Pelvic
Pel- pel-
Support
pelvic health,
CA, right? That's the website.
pelvic health
Pelvic
support.ca.
Health.
Yeah, pelvic health.
.ca.
That's it.
Yeah, pelvichealthsupport.ca. We'll put
Yeah,
that in the comments. Check it out. Follow Marnie. And yeah,
absolutely.
thank you
Thank you
so
for having me.
much.
Yes,
And
it's just
happy
the beginning of the
Monday.
week.
Okay. Yeah,
Okay.
right. Thanks everyone for watching. And let us know if you have any questions. You can post in the comments below. And have a great day. Okay,
Bye.
bye.